Okay, so hi and welcome to Get Healthcare, our podcast. I think this is episode number 3 or 4, and today we're going to be taking some questions from a couple of our users, and we have Dr. Nick Flynn here with us today. Thanks for joining us, Doctor. So I'll start off with the first question. So the first question comes from John in Dublin, who asks, how can I book an online GP appointment in Ireland for same-day prescription refill?
Yeah, thanks, John. Very good question, and hi, Dylan. Nice to catch up again. So the online providers, including Get Healthcare, most provide a prescription service. So when you log on to the Get Healthcare platform, there are icons you can click for to get a prescription, and when you click on these icons, they'll bring you through a pathway that will allow you to request your repeat prescription. And for some prescriptions, it's possible to do this entirely virtually. So that basically is a questionnaire, and there's certain data the patient needs to fill in, maybe their recent blood pressure or their height and weight, how long they've been on the medication, what the medication is for, etc., etc. And as long as the medication is not a toxic or dangerous medication, the patient has been on it for some time, and whatever checks and balances are needed to reissue the prescription safely, as long as they can be answered through the kind of Mediform or the online questionnaire, it is possible to issue what I would call simple prescriptions at that point. There are, however, some prescriptions which are slightly more complicated, and they would require an online consultation with the doctor. And again, the Get Healthcare platform will guide you in a very user-friendly and simple way through this, and move you from the questionnaire-based request to the online consultation. And again, repeat prescriptions can be safely issued online as long as the standard checks and balances around repeat prescriptions are met. And they basically are things like ensuring the medication is still indicated, ensuring the patient is not having any side effects from the medication, ensuring that there's no, if there's a couple of medications being prescribed, there's no interaction between those medications, and then if there is any, as I say, check needed, for example, blood pressure or cholesterol test or anything, arranging that. And again, we'll Get Healthcare's hybrid model, where we have online and in-person GP consultations available. We can arrange the checks and balances that are needed if it needs to go offline to in-person. So in response to John's question, yes, it is absolutely possible to request your repeat prescription online. It is a layered approach from the providers, and in Get Healthcare we're very conscious of that, and some prescriptions can be issued through the filling out of our online questionnaire. Some prescriptions require a consultation, and some require an in-person consultation to reissue the script. And for the online questionnaire and for the online consultation, both of those, John, can be same day. The in-person consultation may take a day or two to arrange. So I hope that's helpful.
Very good, very informative. Emma from Cork wonders, can I get a Fit to Work certificate from an online GP in Ireland?
Hi, Emma. Again, this is a very good question, and one that we get asked quite a lot. So I suppose the short answer is yes, it is possible, but there are a number of factors that would input into that. So there are patient factors. So what is the reason the patient is requesting the Fit to Work certificate? Have they been absent from work for some time with an illness, and has that illness recovered? And can that recovery be assessed and I suppose signed off on through the online consultation? And there are lots of conditions, chest infections, sore throats, simple ankle sprains. There are lots of conditions where it is possible for that to take place. The other variable, though, in a Fit to Work certificate is the person's job and the role. And again, there's a layered approach to this. For some jobs, we don't need any specialist tests to say somebody's fit to work after a period of illness. But for some jobs, there may be, like for example, there may be an eyesight test needed, there may be, a hearing test needed, there may be a blood pressure check needed. And clearly for these, we would need to move from an online consultation to an in-person model. And again, the Get Healthcare hybrid model of online and in-person is very helpful in this regard. I might just say that there's a slight difference between a pre-employment medical and a fit to work certificate, and the pre-employment medical is more detailed than the fit to work certificate after absence due to illness.
Very good. That's all very, very clear. Liam from Galway asks, what are the costs of using an online GP in Ireland compared to a traditional doctor? I suppose I can speak to some of the costs online. So online, you're probably starting off looking, our entry level pricing would be about $16.99, and then we would scale up to as high as $45.99 is kind of the the high end of the scale currently for the online service. In person, the information that I would have, and you could speak to this, Nick, is that an in-person consult is between 70 and 80, depending, with the scale up from there. So we will be offering a hybrid model as well. So we will have in-person consults, which will probably be around a similar price, but kind of hybrid, so that a lot of the work can be done online. And we'll have other tiered offerings in time. The pricing will scale up from our current kind of more basic offering, but maybe you could speak to that around pricing as well, Nick.
Yeah, so again, Liam, to that question, if I could speak maybe about the cost base of providing the service, that might help people understand why certain fees are charged. So with the cost base of the online service, there's an online infrastructure platform, and again, Dylan, you'd be an expert in that, but that's a cost that once established, it's scalable without adding new clinics, let's say. So you don't have the same cost as you would if you're in a bricks and mortar or traditional clinic and adding rooms or adding a new location. So the bricks and mortar clinics really, most of my practices have been in traditional bricks and mortar clinics, but you've got your rent, you've got your light and heat, you've got your insurance indemnity, and you've got your doctors have to travel to the location to work, and there's a cost inbuilt in all of that that really you can't avoid, and therefore the bricks and mortar or traditional GP consultations where you see the doctor in person, they do need to have a higher charge, and you're right, then it's in around €70 I would think in most practices at the moment for an in-person charge. The online providers, because the doctors don't have to travel to work, they can work from home. The infrastructure cost, once the platform is established, tends to be scalable without huge additional costs, and clearly utilities and stuff are less. So the online providers are able to provide more cost-effective consultations for patients, and again, we see all the time, and I know, Dylan, that this is part of your motivation in establishing Get Healthcare. We see all the time that the cost of seeing a GP is a barrier to some people accessing healthcare, and the online providers, and certainly Get Healthcare, are helping to lead the way on this. Are helping to provide more cost-effective and affordable consultations, and access to healthcare is more affordable through services like Get Healthcare. So well done on that. Okay,
definitely. I think the hybrid model definitely will allow a lot more accessibility for people. Okay, so a question from Aoife from Limerick. She wants to know, do online GPs in Ireland provide mental health consultations and support?
Absolutely, and again, Aoife, thanks very much for the question. So I think the online space was the first, mental health support was the first type of medical service to move online. Clearly, it's important to ensure that people who present with mental health problems and mental health illness, it's important to ensure you don't have a physical cause to that, and so it's not that physical examination is never needed for people who have mental health problems. However, in general, the assessment of a patient who presents with psychological distress and mental health problems, it is a conversation or a talk therapy. The assessment by the clinician or by the doctor of the patient is in listening to their story, asking relevant questions to help the doctor to diagnose the problem, because we have lots of psychological distress that actually is, I would say, a normal part of the human condition and hasn't become pathological, and it's important to separate that out from pathological anxiety, depression and psychosis. And again, the way in which the doctors do this, it's through talking to the patients and eliciting the relevant answers and symptoms. So yes, from a diagnosis point of view, the online consultations are very suitable for treating and diagnosing people with mental health. When it comes to the treatment itself, again, very, very suitable for talk therapies, psychology and GPs to diagnose patients and treat them with mental health conditions. And it really facilitates a continuity of care as well. One of the challenges I see as a GP in a bricks and mortar or traditional clinic is that patients, especially with depression but also with anxiety, they often miss appointments. So it's not uncommon for the anxious patient to be unable to leave the house, and so the do not attend rate for a patient with anxiety and severe anxiety and panic attacks is a lot more than you would see a patient with other conditions. And same with depression. I mean, depression is a significant mental health condition that often patients lack the motivation for self-care and lack the motivation, to get to appointments. So from a continuity of care point of view, being able to consult with your doctor from the safety and comfort of your own home is something that's very, very helpful, and I would say is probably one of the unique situations where the online consultation can actually even be better than the in-person consultation.
And availability as well.
Absolutely, availability.
There's a lot there, really. Very good answer. So Cian from Waterford inquires, how does an online GP in Ireland diagnose and treat common conditions like sinus infections?
So again, Cian, thanks very much. I'm a Waterford man myself, so I'm delighted to field a question from Waterford. It comes down to what is the ceiling of care that we can provide safely online. So again, lots of common conditions, sinus infections, sore throats, or eye infections. Maybe ingrown toenails, sprained limbs. We can diagnose a lot of these conditions safely online, and there comes a point when we've reached the ceiling of care for online diagnosis and treatment, and then we do need to recommend that patients go to an in-person clinic. And when we reach that ceiling of care, the doctor in the consultation will know that, and we're lucky at Get Healthcare that we're developing out the hybrid model of in-person and online. And certainly, when the online consultation reaches that point where it requires an in-person consultation, we'll do that. But there are lots of minor illnesses that just from the history taking and from the visual assessment of the patient online, that we can safely make diagnosis of simple minor ailments and advise on suitable care plans and prescriptions if necessary for those.
Okay, very good. Sophia from Kilkenny asks, can an online GP in Ireland issue a medical certificate for work or school?
Thanks again, Sophia. Yeah, so this is a question of illness certification. And so illness certification can be issued through an online consultation. The important principle for doctors in issuing illness certificates is that they review the patient's condition and are satisfied that the condition, when they have regard for what the patient actually does, the role at work, that the illness makes them unfit for work. And so an online consultation, absolutely, a doctor can make a diagnosis, and then with consideration to the patient's role at work, what they have to do, they can safely issue an illness certificate for that patient. And similarly for school certs, it's the same. And again, we have students who due to illness are unfit to attend school, and then due to lack of availability from their home GP, or they don't have a home GP, we see a lot, or they can't afford a traditional GP consultation. They would be the three things I think that patients feedback to us, I think, of why they use an online service for illness certification. It's they can't get to their GP, or they don't have a GP and can't sign on with one, or they can't afford one. They're the three main things I see. And certainly we can, and Get Healthcare does, offer an illness certification service.
Very good, very good. Ella from Kildare asks, are online GP consultations in Ireland covered by private health insurance? Well, I know the answer to this one, and that yes, they are. We issue receipts that can be provided to the insurance company, and there can be a claim made back against all interactions. So you're fully covered with an online provider. If you have anything to add there, Nick.
No, except that that's my understanding as well, that once you consult with the doctor and the doctor gives you a receipt for the fee paid, that whatever the arrangement you have with your own insurance company, that receipt is accepted by the insurance company. That's my understanding.
Yeah, very good. So Grace from Donegal asks, can I get a virtual consultation with an Irish GP for my child's minor illness?
Yes, is the answer, Grace. You can. It's a good opportunity, I think, then, though, to remind patients that online is not suitable for everything. Yeah. So severe and life-threatening illnesses should certainly not be moved to the online consultation space. They need to go immediately to an emergency department. Chest pain in adults or children would be unsuitable for online. I would say also for very young children under the age of 12 months, we shouldn't consult online. It should be with your bricks and mortar traditional GP service. But for older children with minor illnesses, and lots of this can be, reassurance that the condition is self-limiting and doesn't need any antibiotics, for example. Common one. Feeding problems, another common one that we deal with online. So there are lots of minor ailments with children which can safely consult online. But important to say, there are limits. Patients and children under the age of 1 and with chest pain or severe life-threatening illness, or any illness that might need, say, an X-ray or an investigation, so a suspected broken bone or something, they should not come to the online space.
Okay. Excellent. Thanks so much for your time, and we'll run this again next week. If anyone has any questions or queries, they can pop us onto us on an email, info@gethealthcare.ie, or you can follow our socials, Get Healthcare, on Instagram, we're on LinkedIn, we're on Twitter as well. Again, thanks, Nick, for your very clear and understandable answers to all those questions. And if anyone else has any questions, please send them in to us, and we'll try to answer them in due course.